From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
And good morning on this Saturday morning. It's 10 o'clock here in Sumter, South Carolina. Thank you for all. We have Medical Forum. I'm your host, Jeff Reed. I want to thank all of our listeners out there. Dr. Chris Marr, my co-host. Chris, how are we doing this morning?
Fine, Jeff. How are you?
Good. You know, we talk, it seems like, every week, the first thing that comes out of our mouth is how hot it is. And we had the same thing this week. Is it ever going to cool off? What's your opinion?
My opinion is, if you don't like the heat, move north.
Move north? I mean, it used to be, if you don't like the heat, wait 10 minutes in Sumter and something changes.
And it might
we got
rain.
A little bit of rain in parts Thursday and Friday. But, you know, it's just been crazy. But, you know, last week we had Jeff Fall on, speaking of crazy.
Always a great show with Jeff.
Isn't it? You know, and for the people out there, the big golf tournament, it's not exactly coming up. It's certainly within eyesight. I think October 9th, they have that great foundation golf tournament.
I heard they're engraving your trophy again.
You know, they've already got it started.
I think they're starting to work on that.
Well, and you know, we've invited Tiger Woods this year.
Have you ever seen the guy hold the Stanley Cup with the white gloves? I think that's who's holding your trophy. The Stanley Cup holder.
Well, you know, we're just honored to be a part of it for the one time.
It's all for a good cause.
It's
right?
all for the cause.
As long as it's for a good cause.
It is.
It's okay to win
it. But, you know, want to thank some of our sponsors out there, too, before we get kicking today. Sandy Wilson and Karen Schwartz will bind them. Stop by and give them a call at 469-3030 for all of your insurance needs. Of course, we just talked about the aforementioned Jeff Fall. Give him a call down at the foundation. Talk to him about that golf tournament. Brought on a new sponsor, Tri-County Medi Home Care, Chris. I believe you know them
Tri-County's a strong force in the Sumter market. They have hospice care. They have home health. They have durable medical equipment. And they take pretty good care of their patients. So, any concerns, any problems, need for home health, hospice, let your doctor know.
Good ally of the show. We also want to throw out two more to Reliable Medical Equipment, as always. Thank you. And our presenting sponsor, At Your Service Home Care. Go by and see them for all of your home care needs. Or if you just need some good medical advice, from legal to hospice, home health, as we just mentioned. They're on Wilson Hall Road as well, just down from Bynum on 607-9677. Yes, sir?
A lot of the guests we've had on the show who are experts in their field, for instance, Glenn Givens, you know, we have regular contact with Glenn, and we can get you appointments with his office.
As an attorney.
Absolutely. Yeah. Absolutely.
Well, we've learned a lot, and today I'm excited because we have Miss Brooke Luce in the house. She's a good friend of the show and a good friend of all the companies that we've talked to. Brooke works at Sumter Rehab. And, you know, we had a good friend of hers on, Dr. Kim, on earlier, and Brooke assisted on him. But the show was focused a lot on some of the things that Dr. Kim brings in, and we'll bring him back up as the show progresses. But, Brooke, thank you for coming in on a Saturday morning.
Thank you for having me.
You got it. Why don't you do this? As we start this first segment, we always like to give the guests time, give us a little bit of background on you and your three beautiful children. And tell us about all your endeavors through the medical field, which are quite a lot, especially given your young age, which is always great to have good young people with great resources. So, Brooke, give us a little bit of background on Brooke Luce.
Okay, well, my name is, again, Brooke Luce, and I am with Sumter East Health and Rehabilitation Center. Located on, we actually have two buildings. One is located on 880 Carolina Avenue here in Sumter, and the other building is located on 975 Miller Road, which actually has our new rehabilitation wing on. Me personally, I do have three children.
Give a little shout out to those three, please.
Yes, hello, Peyton, Pearson, Cruz. And I've been in this field and in the Sumter area, Camden area, for about 9 years. And doing this, I've dabbled in everything, and between hospice, home health, medical equipment.
Right.
So, small world.
So you know just about everything that we've talked about here, which I think is great for your job. And one thing that we'll want to point out, when you talk about Carolina and Miller, for those of us that might be like me, a little geography challenged, they actually back up to one another, correct? So it's not like we have one on one side of town, then we got to go somewhere else. They actually just happen to, from an address standpoint. But it's right down, come down Miller Road, and you see your first one obviously on Miller Road. But if you circle all the way around, right?
Right. And I mean, if you go down Miller Road and our building is on the right, you'll see Angel's Mexican Restaurant. You just take a right there. And then our other building is right there on the right. So literally, I mean, there's a path in between the two buildings that connect.
So good. Right here in Sumter.
Yep, absolutely.
Very good. It's always good. And Chris, we always talk about support Sumter, support Sumter, support Sumter, not only from a physician standpoint, medical equipment standpoint, prosthetics, orthotics, home care, but obviously we have some great skilled nursing facilities. And I know you're very familiar with the facility, Chris.
Absolutely. I had the opportunity to meet the physician director of Rehab, Dr. Kim, a month or so ago, and a great physician trained in New York, I believe, came down from the Northeast, has some specialty training in physical medicine and rehab, really helping to get patients back to meet their goals, their baseline goals. Great physician.
And we'll talk about, because we're going to talk about all your staff, because I think that's a tremendous aspect of what makes Sumter Rehab so big. And, you know, I was honored to come. You had an open house to introduce this new rehabilitation facility. Big screen TVs, beautiful hardwood floors, nice big rooms, which we'll talk about all the things. And, you know, as we come up here on our first break here, probably another minute and a half or so. But again, Brooke, what's a contact phone number so we can get that number out there to everyone listening in? And then as we come back from break, we'll talk about your facility and it's the tremendous facility, the two-tier facility, and we'll talk about rehabilitation and skilled nursing and bring people up to date on all that. But again, give us a contact number as we close down on this first break here. And how do we get a hold of you? And the address one more time, please.
Sure. Okay. Again, the name of the facility is Sumter East Health and Rehabilitation Center. And the buildings are located on 880 Carolina Avenue, Sumter, and 975 Miller Road in Sumter. And the actual facility number that you can reach me at, just ask for Brooke, is 803-775-5394. And to reach me directly, my cell phone number is 803-840-7515.
Great.
I'll be happy to help y'all.
And as we come up on our first break, let's encourage people to support Cheryl Fluharty. She's a community educator for the aforementioned MediHome Tri-County. Got a great new support group, great, and it'll be at our location at Your Service Home Care on 1250 Wilson Hall Road. It'll be your third Thursday, beginning from 6 to 8. Medical issues from lost a relative or what have you, stop by or give her a call, 905-7720, and we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum on this Saturday morning. We're talking this morning with Brooke Luce with Sumter East Health and Rehabilitation. And Brooke, before we left, we were talking a bit about the facility. And the facility's had a recent facelift. Has been significantly updated, new staff brought in. Tell us a little bit about the facility.
Sure. We actually have 176 beds in our facility. Of course, it's kind of split up between, those beds are split up between the two locations. And as I said earlier, in our location on Miller Road, we actually did do some renovations on our two front halls, in which we do rehab, and we work with Dr. Kim and our comprehensive therapy team with providing some extensive rehab to our residents.
Dr. Kim actually brings a very specialized type of medicine, a very specialized practice of medicine to the Sumter community, and I believe probably at this time he's the only PM&R doctor in Sumter.
Yes.
Correct me if I'm wrong.
Hey, what is that?
So
a PMR.
PM&R is a physician who specializes in rehabilitation. It stands for Physical Medicine and Rehabilitation. It's actually a separate residency program. As you know, physicians go to medical school, they get basic training for their first 4 years, but after that they specialize into a residency, whether they specialize in primary care, emergency medicine, or physical medicine and rehab. So a physician like Dr. Kim spends time taking care of stroke patient, for instance, and trying to develop a rehabilitation program to maintain their pain, reduce pain, increase mobility, increase activities of daily living, and really try to get the patient back to baseline as quickly as possible.
Yeah, absolutely. And we also have not only Dr. Kim that works with our residents, we have, we've mentioned him before, Dr. Jim Morrison, who is our wound care physician.
Right.
And so he actually sees all of our patients with any type of wound. So that actually adds to the type of services we provide.
Which is fantastic. Not every facility has wound care in the facility. So the patients are already having problems ambulating and leaving, walking. So to have these services right there in the facility to take care of the wounds, fantastic service.
Well, and I think you also mentioned you have a new chief of staff. Is that the correct terminology?
Well, we have a new medical director. His name is Dr. Tony Shahan, and he is actually he's actually based at the VA, and it's where he services a lot of his patients. But we've just signed on. He's just signed on with us, along with his nurse practitioner. Her name's Loretta Schaefer, and she is actually going to be in-house in our facility Mondays, Tuesdays, Thursdays, and Fridays. So there is someone that is actually present in case there's a change of condition. It's not, where we're having to call out to our medical director and get what we need. It's actually handled right then and there.
Well, and I think here's something that would be a question I would ask. If I'm already seeing Dr. Marr, and Dr. Marr said, "Oh, I'll come to the facility and see you," he can do that. Is that correct?
Absolutely. Now, if typically when a patient is being admitted, we talk about the physicians that we already have contracted with our facility. Now, if they have the desire to keep their current primary care physician, like Dr. Marr, we'd reach out to him and see if he'd want to contract with us under an attending physician agreement. In that case, he would come in and be responsible for that patient and the orders and so forth.
That's great, because I think that's what, with the new system of medicine, one of the things I think people don't realize is that once they get admitted to the hospital, they see a hospitalist, whether it's at Toomey or Lexington or what have you. Very, very few, if any, still continue to have their privileges. So if I'm seeing Dr. Marr and I go in at the time where I might need him the most, his privileges, and it's just because of the Medicare system. It's not that he doesn't want to do it, and it's the paper. And you might be able to add to that, Chris, rather than me paraphrase. Why aren't doctors seeing their patients in the hospital now?
Well, actually, I had performed inpatient and outpatient medicine for several years. It's been about 4 years since I no longer see patients in the hospital. There's a little bit of a misconception. All of the physicians at Colonial Family Practice have admitting privileges at Toomey Hospital. So we're all on medical staff at Toomey Hospital. We have contracted with physicians on staff who are called hospitalists. And the reason being is by contracting with physicians in these facilities, not having to go to multiple facilities throughout the day, it allows us to spend more time in the office. When I discuss this with patients, I tell patients that they need me in that office 95% of the time. And as you know, Colonial Family Practice, our slogan is, "We'll see you today."
Right.
Well, in order to see you today, I need to be in the office. If I have a waiting room full of patients and I was doing hospital medicine, if the intensive care unit calls you, then you have to leave that waiting room full of 10 patients and go to the hospital. So what this specialization has created is a more efficient system for us to see the patient and take care of their needs in the facility we're in.
Well, and I know from working with both of you and getting back to the Sumter Rehab situation with you being able to be the physician in there under the contract, we share paperwork all the time. So if I'm in the hospital and I see a hospitalist, you're being informed the whole time. And I know that the hospital encourages me to see you within 24 hours once I am discharged. So then if there's any changes that you need to make or be aware of, we usually try to arrange that. And I think that's really what communication's the biggest thing. And I think what I would take from what you said, Brooke, you have physicians on staff, and in some cases even more qualified as far as using Dr. Kim as the example. And then Dr. Marr still has the ability, if chosen by the patient, to still be able to come and contract. So it's the best of both worlds is what I'm hearing.
Absolutely. They can keep that continuity of care that they have with their primary care physician, and then also use the specialists that we have in-house to kind of complement what he's doing and focus on the issues that they have. That's
wonderful. We work very closely at Reliable Medical Equipment with two of your PTAs and such. Robert Lemmer, he's fantastic. Awesome. Known Robert for 20 years now almost. And Lana Kay.
Oh, man.
So want to really give a shout out to them. And who else on your staff? As we come down here with about a minute to go, let's talk about Terry maybe as we close on this second segment.
Terry is our social worker. Her name's Terry Golightly, and she's worked there for several years. And her concentration is, of course, counseling any of the residents that they have any issues or that come up as far as power of attorney or living will or DNRs or anything like that, addressing those things, but also setting up discharge. So from day one, when the patient's admitted, she's looking at the patient and and determining, okay, what do we need to be able to discharge them home safely and appropriately.
Great. We're going to cut away, and we'll be right back. Brooke, Luce here on Medical Forum on your Saturday morning.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
This is Medical Forum, presented by At Your Service Home Care.
Oh, and we are back on this Saturday morning. And Medical Forum, just to let you know, also, if you're catching part of the show or you're catching the tail end of it, I want to hear it all again. We do re-air from 2 to 3 on Sunday. And we have Brooke, Luce, Sumter Rehab here on Miller Road, also on Carolina Avenue. And Brooke, when we left, we talked about your great staff, but now I got a question. How do I get admitted into the facility?
Well, certainly the most common way is through the hospital. And the discharge planners and case managers at the hospital, when you're admitted there for some medical reason, you can certainly let the staff know there, and they will help coordinate that discharge and admission to our facility. But another way that most people don't know is, and depending on insurance, which we'll get into in a little bit, your doctor can refer for you to go to a skilled nursing facility and receive rehab.
Brooke, tell me a little bit. In the past, there's been very specific Medicare requirements for admission to rehab that I was aware of, including the need for length of stay in the hospital and then subsequent admission. Let's talk a little bit about the old requirements first, so that people understand that there are actually requirements. You can't just stop by your doorstep and walk in and admit yourself like a hotel room. There are Medicare requirements which people don't understand. And then talk a little bit about the new requirements.
Okay, well, it used to be it was much easier to get admitted to the hospital. I mean, you could be admitted for the littlest thing, and then from there, you could just say, I want to be admitted to a skilled nursing facility, and then they'd hold you for 3 days, bill Medicare, and off you'd go. Of course, Medicare's tightened up in every area of healthcare at this point. I mean, we've seen it in DME, we've seen it in home health, hospice.
Right.
they're having to be face-to-faces and such now. But now there has to be a real need for a patient to actually be admitted inpatient to a hospital. And a lot of times what hospitals are doing to compensate for situations that are kind of borderline, they're gray, it's they'll admit them under observation, which would not count towards a 3-night stay, which is what the requirements are now.
Well, let me ask you this, Brooke. We have a rehabilitation, and then we also have a nursing home. Mm-hmm. So are we exclusively talking about rehabilitation? So if I want to go to the rehabilitation facility, and let's take that for example, let's use Medicare as our insurance base, since a lot of our listeners predominantly have that. Talk to us about the 20-day, 80-day, 100-day rehabilitation. What are the rules to get in? Why is the number 20 so important? Why is the 100 so important? And then talk to us about how you guys not only can do the rehab, you also might be able to help us find some copay and some insurance help. So talk with, I think I'm a candidate for rehabilitation. What's the criterion first? Right,
and you have traditional Medicare, red, white, and blue card.
Yep.
The requirements are that you have had a 3-night stay in a hospital. Okay. And so starting off with that, you've had to have a 3-night stay in the hospital within the past 30 days. As I said before, the most common way is to be transferred directly from the hospital, okay? But sometimes, let's say, family's in there with you and they're like, okay, I think we can handle this. We can take care of mom at home. And then they get home and they're like, oh, this is not what we thought it was. We can't handle it.
So I got about 27 days to make this decision.
Exactly.
I made 3-day stay, come home, everything's good, and then we look up 10, 15, 20 days later and go, we can't handle this.
Right. And the 30 days actually start from the discharge date.
Okay.
Okay. So that 3 nights are not included in that 30 days. Okay. So let's just say this is a situation where you knew when you got admitted, you let the hospital know you want to be admitted to a rehab. Okay. From that point on, basically the hospital will take it from there. And you let them know you want to go to a rehab, you want to go to Sumter East Health and Rehab.
Right.
And the hospital will get in contact with me, and then I will in turn get in contact with the family.
So you would come to the hospital?
Absolutely. I do bedside.
Okay.
Yeah.
So you come, let's just make it as simple, if we can minimize simple. I have a knee replacement, and now I'm in the hospital. I've done my 3-day stay with the observation. They do this, and now I've got to get rehabilitation for my knee. I can either go home, I can either go to an outpatient facility, or I can choose Sumter Health and Rehab.
Right.
And the choices are there, and I want to hear all my choices. And here comes you to my bedside, sell me on why I want to come to see you, and then explain to me. And let's go ahead and say I'm 68 years old. I have Medicare. Right. Talk me through. I've done the 3-day. Why do I want to come there? What should I expect? How much is it going to cost me? And I have no secondary insurance.
Okay.
Is that good? You got me?
I gotcha. All right. So the first question most people have is about payment. Okay. So you have traditional Medicare, and Medicare, after the 3-night stay, it actually activates 100 days, okay, for rehab. And the first 20 days are paid 100% under Medicare, no charge. Okay. So you come in, Medicare pays for it 100%. The next 80 days are paid 80%. Okay, so there's 20% left over on the next 80 days. Equates to about $151 and some change a day.
Okay.
Okay. Reason why you want to come to Sumter East Health and Rehab is things like we've discussed earlier in the show. We have Dr. Kim, who specializes in rehab. Maybe you have a complication, or you have diabetes that may complicate the wound. We have Dr. Morrison that will help with that. And we are actually owned by Sava Senior Care. We have cornerstones to our company that actually adds quality and value to the care that we provide, like our ambassador program. where you're assigned like a concierge as soon as someone that's matched up with you when you come in the facility, and checks on you daily and is there at your beck and call.
Okay. Now let's talk about the 20%.
Mm-hmm.
I guess my options are: I have Medicare only after 20 days. A, I leave the facility.
Right.
B, I pay
$51 a day.
$51 a day, and that's for every facility. So it's not just you guys. I mean, is during that dormant, we'll call that 20-day period. You have people that also help me try to see if maybe there's some help with the Medicaid.
Absolutely, we have a great business office manager. Her name's Pam Coffey.
Tell you what, because anytime we talk about money and qualifying, we don't want you to rush on it. We're coming up on our third break. Want to thank all of our friends down at Bynum for their sponsorship of the show. Give them a call at 469-3030 for all of your needs, especially anything from your auto, home, see Sandy, anything from your business and your health insurance, especially with Obamacare and everything coming up with re-enrollment. Please stop by and see Karen Schwartz, and we'll be right back after this message.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we're back with Medical Forum here on this Saturday morning. Remember that we re-air on Sundays at 2 o'clock if you missed any part of the show today. If you have any needs for family members, dealing with family members who have needing service in the home. Family members don't want to go to nursing facilities. Please contact us over at Your Service Home Care. We specialize in companionship, shopping, errands, assistance with ADLs. You can call the office at 803-607-9677.
Very good. On Wilson Hall Road. And we want to thank all of our people that have used that service. It's been a tremendous business for us, Chris. I enjoy it every day that I work with it. Brooke, I know that we've worked with you with a few patients, so thank you so much for what you do. And getting back to where we left the last segment, for anyone who's just tuning in, we're using an example of a 65-year-old or older patient with Medicare and Medicare only, who had knee replacement, and getting to the facility, which, to recap, a 3-day stay in the hospital, call from a social worker. Brooke meets you in the hospital, touts all the things that we've talked about so far with their fine staff, from Dr. Kim to Robert to Lana Kay to the whole therapy group. Now, I'm 20 days. I'm in great shape as far as Medicare taking care of me. So now everything's going wonderful with my surgery. I'm getting the rehab that I need. I'm 20 days into it, and I've got a choice. I've either got to leave the facility, pay $151, or, and what maybe sets your facility apart from some of the other facilities, is you've got people that will help me possibly find funding for the 20%. Is that correct?
That's correct. We actually have a great business office manager, Pam Kaufman, and what's different about us too is we're Medicaid certified, so we can receive payment from Medicaid. A lot of facilities, skilled nursing facilities in the area, are not Medicaid certified. So Pam will actually help with that process. And what we try to do on admission is anticipate those needs. So, if it looks like, we actually do a 72-hour meeting after admission with the patient and kind of looking to see, okay, at that point, our physical therapy has evaluated the patient to see, okay, this is where it looks like this patient is going to go with their therapy. It looks like it may take longer than 20 days. So, at that point, we'll kind of identify that, initiate the Medicaid application just in case, if there's not a secondary. And Pam helps with that process. And if they are, as long as you put in the application and you're Medicaid pending, and Pam can kind of identify at that point when you give them all the financials and that sort of thing, whether or not she kind of believes that it will be approved.
Well, and using that example, so if I'm a Medicaid primary, I'm in good shape. I mean, if you have Medicaid availability, if I have Medicaid as my insurance and I have that same knee replacement, does your facility take Medicaid and for my rehabilitation, or is that even the same example?
Well, it's kind of two different things. Okay? If you have Medicaid primary, it's a little bit harder to get inpatient rehab.
Okay.
We do not discriminate as far as payer source. Certainly for us, Medicare replacements, private insurance is kind of what we look for.
I gotcha.
But basically, with the Medicaid as primary, that's something the hospital's going to identify ahead of time and kind of look for a bed in a facility for them.
So that's a hospital. Dr. Marr, what if you want to refer?
So
how does this work?
One other scenario that occurs frequently is the patient has had a 2-day stay at the hospital and then oftentimes may be discharged, not having received any rehabilitation at that point. Will present to my office and will determine the need for rehabilitation. And Brooke, I believe that's also criteria too for admission.
Right. So basically, as we kind of talked about before, we kind of went back and forth a little bit with, let's say you're in the hospital, you stay 3 nights, but at that point, again, your family says, oh, we can take care of you at home. And you go home and the family says, okay, this is too much. Physical therapy isn't, with home health is not cutting it. Okay. We need more intensive therapy. So at maybe a follow-up appointment with Dr. Marr, you kind of, identify, or the family mentions that, listen, home health just isn't cutting it. We need more help. We need more assistance in intensive therapy. At that point, as long as it's within 30 days from that discharge date from the hospital, Dr. Marr would contact me, and I'd receive an order from him, and we'd go from there. There's a few other things that need to be put in place, but that's the basics of it.
Gotcha.
An issue, Brooke, that we were talking about before the show that is new to me is the change in the criteria for certain Medicare plans. In the past, the criteria has always been that the patient needed to be in the hospital for 2 full days, meaning at least overnight, 3 nights. Well, you call them 3 midnights, I believe. Mm-hmm. But I believe that this criteria has changed a bit. Tell me about that.
Okay, so I think you're referring to the Medicare replacements or Medicare HMOs like Care Improvement Plus, Humana, essentially plans that are contacting people with traditional Medicare and trying to get them to come on with their plan. Okay, so basically with those Medicare replacements, they are different from traditional Medicare because they do not require a 3-night stay in the hospital. And so you don't have to have been in the hospital in the past 30 days or at all. And so you can go into your physician's office and say, I'm really interested in seeing if I qualify for rehab and a skilled, at Sumter East Health and Rehab and their skilled nursing.
So if I came in and you called it the red, white, and blue card that everyone was familiar with, and 10 years ago, that's all there was, maybe even 5 years ago. And for those that are getting close to 65 or not familiar with that, once you get to Medicare, you're going to be engulfed by a lot of subsidiaries of Medicare, like you mentioned, the Care Improvement, Humana, and such like that want you to come onto their plan. Now, it's still a Medicare-based plan, but their rules are, and I don't want to use the word entice because it sounds wrong, it's to encourage you to come with them. So if I have the traditional Medicare card, as Chris said, the 3 days, 3-night stay is a must to be able to be admitted into the rehabilitation. However, if I take one of the subsidiaries, and we'll just use Humana as an example, I might be able to just see my local physician and not have to have the 3-day stay, not even a day stay. Right. And I tell you what, we're coming up short on a break right now. We'll be back with our final segment, and we'll continue to discuss this because it's very confusing for the seniors and very confusing for people that are approaching that age. And we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street, voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnston with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum on this Saturday morning. We re-air again on Sunday at 2 o'clock. We're here with Brooke Luce today talking about acute rehab. What we'd really like to do, we were talking at the break about how confusing these issues are as far as different types of facilities, assisted living facilities, nursing home facilities, acute rehab facilities, all being very different. They have different qualifications, they have different payer sources, and they all have different goals in mind. So, Brooke, let's try to break these things down specifically, one by one, and talk about each one specifically with different issues in mind. So let's start with rehab. The purpose of rehab is?
The purpose of rehab is to get you back to your prior condition level before whatever incident happened, or whether it was a slow decline, to get you back up to the level you were at prior to that incident.
So again, rehab is a short-term solution,
right?
Correct?
Correct.
What about a nursing home? What's the purpose of a nursing home?
Well, the majority of nursing homes, they have a rehab section, okay? But there's a long-term care portion to a nursing home, okay? The majority of people that come in will come in under rehab, get the therapy that they need, and then say, listen, we liked it here so much, we want to stay, okay? So at that point, they transition to our nursing home portion of the facility.
Comparing those two, what about assisted living? How does that fall into the mix as far as a purpose?
Well, basically with assisted living, and the biggest difference between skilled nursing facilities, rehab, and assisted living is rehab and skilled nursing facilities have to have just that. They have to have a nurse there 24 hours a day, 7 days a week. Assisted living does not have to have that. Some occasionally have a nurse there that'll document monthly on each patient, but there is not a nurse there 24 hours a day, 7 days a week. In order to stay in a rehab or a nursing facility, there has to be a skilled need with the patient.
All right, let's back that up a little bit. Let's talk about the assisted living, because I think that's a referral base for you as well.
Absolutely.
I go to an assisted living because I just don't get around as well as I want. Some people go because they're tired of mowing their yard, and the spouse, the family's moved away, the spouse is deceased. I want to kind of, for lack of a better word, almost like joining a little sorority fraternity. Mm-hmm. And I have friends there, and it's a lot less complicated in meals. But now I've deteriorated from assisted living. How if I have to make that judgment call for a relative of mine, and they said she just can't stay here, you become the viable alternative. Is that correct?
Absolutely.
Okay.
And the normal sequence on how it works is, and it goes from like independent is the least, amount of assistance that you would need, independent level of care, okay? And then you would go to maybe a residential care facility, which is a little bit smaller than an assisted living facility. And then you would go up to an assisted living facility, and then from there, if you can't stay there anymore and you've just gotten to the point where you can't get around by yourself, then you would go to a skilled nursing facility, okay? So the skilled nursing facility is the highest level of care that you can receive.
Okay. Or they could stay at home, and that's when you're going to have full-time attendants that come in to take care. And here's the tough part of the whole show. When we get to skilled nursing, or we stay at home, it's costly. Skilled nursing facilities somewhere range anywhere, Brooke, you go ahead and give it to us, from what to what, probably depending on the need once you get in there, and what all you need to have from care and 24-hour service. I mean,
now, just to stay there privately with no insurance at all, just to live there is $6,000 to $7,000 a month, and that's for any skilled nursing facility in the area.
And that's what we've talked about so much on this show, where Medicare is a great vehicle to pay for a lot of things, such as Dr. Marr's visits, which we encourage you to do at his new location on Boltman.
698A Boltman Drive.
Yes. No. Nice, but it's a great vehicle for medical equipment, for doctor's visits, pharmacy's good, hospital stay, getting the procedures that lead to your rehab. And it's great for the first 20 days and pretty good for the next 100 days as you rehabilitate your knee, or for many things. We use knee as the example, but shoulder, anything, a stroke.
Overall deconditioning.
Everything deconditioning. Yes. But now, after the 100 days, or after we've decided, even if it's assisted living, that is your personal money that you pay for. And skilled nursing, depending on what your assets are. But if you have assets and you're listening out there and you're maybe in your 70s, be very smart to consult an attorney to start lining up things that possibly could allow you to get some government assistance at facilities like yours, or it becomes a very expensive proposition the rest of your life. Is that's true?
I agree, and I'm not too much of an expert on the
right.
legalities of Medicaid, but I do know which is what 99.9% of people have that stay long term in a skilled nursing facility. Mm-hmm. But I do know that there's a 5-year look back when they do the application process. So look.
And a look back
that.
simply means they're going to look at your assets. So if I'm 65 and I turn everything over to all of my kids, my house, my money, my everything, and something tragically happens to me at the age of 68, they're going to look back and they're going to look at that as if I still have that.
Absolutely.
There would have to have been 5 years that would have been passed by that time.
And I think another really important point is, Jeff, you and I have talked about this. Planning is really important. Mm-hmm. So we can talk
Crucial.
About trusts and hiding assets, but really the right way is to take long-term care insurance out. And we've talked about that on the show in the past.
It's certainly an alternative.
We need
Absolutely.
to prepare for the need for these situations, so that if we can no longer take care of ourselves, our children are left with the burden of that.
Right.
So long-term care insurance is not really ensuring your well-being as much as it's ensuring
right.
your family's well-being, because they're going to at that point have resources to help take care of you at that time.
Well, we plan for everything. Kids going to college, we're planning for this and that. And then here we go. We look up and they're at the prime of their life having to take care of us. Brooke, we are up on the end of the show. It's been a quick hour, very knowledgeable hour. Last 15 seconds, name please, and phone number to contact you for all the questions that they might have.
Sure. We are Sumter East Health and Rehabilitation. My name is Brooke Luce. I am the admissions director. We're located on 880 Carolina Avenue. Other building is 975 Miller Road. You can stop in at either one of those locations for tours. And my contact number for the facility is 803-775-5394. And my cell phone number is 803-840-7515.
Great. Thank you, Brooke, and we'll see y'all next week.